Hello everyone, and welcome to the Winner's Circle. Today we have a wonderful guest with us, Belinda Burnside, who is an osteopath who works on humans and horses. How about if you tell us a little bit about your background and how you got to where you are?
So I did my training in Australia, and osteopathy in Australia is what they call here traditional osteopathy, or osteopathic manual medicine, because it's hands-on and it's the philosophy of the body being a whole, a self-healing unit, and restoring motion to the body. And horses are all about motion. Their whole entire body is geared, all their anatomy is geared for motion. They can go from standing to a gallop in a second, and every piece of their anatomy works together to do that. So I grew up around horses. I've always loved horses, and when I did my training in Australia on people, they offered a postgraduate degree in animal chiropractic. So the vets, the chiropractors, or the osteopaths were able to do that, and we all trained together. And so part of my practice is working with horses, and part of it is working with people, and then I also work on both the horse and the rider, and that's really interesting to see.
You mean the horse-rider combo?
Combination,
So
yes.
do you find that a horse might reflect a human's challenges, or a human might reflect a horse's challenges?
I see that all the time.
Wow.
Often, yeah. There's the same pattern of movement or restriction going on in both the horse and their rider.
And is this usually caused by a relationship, or is this caused, like, might a rider be attracted to a horse with a similar kind of?
I think it's probably a bit of both. I think sometimes, you ideally become one with your horse when you ride. So sometimes that lack of movement in the rider translates to the horse, because the horse's back is like a filter for the movement, or vice versa. A crooked horse can throw off and create a crooked rider.
So I think we need to back up a little bit here and describe what is osteopathy. Is that how you say it?
Osteopathy, yes, or osteopathic medicine. It is a philosophy, a science, and an art. So that's the science of human anatomy and physiology, based on the principles that, like I said, the body is a whole self-healing unit, and that structure or anatomy and function, physiology, are intrinsically interrelated. One affects the other, and the body is a whole, body, mind, spirit, and then rational treatment is based on those things. So with the horse, it's really interesting, because I find that mind component is, you have the pyramid, the body, mind, spirit pyramid, and that mind component in the horse is a lot less, and they're just all body and spirit too, and it's quite wonderful to work with them.
So that in that pyramid, the mind is maybe stronger, kind of overrides the spirit for
humans. Yes, we can talk ourselves out of something, or think something, or just be so involved in the pain or the rationale behind why this hurts and why we can't. Whereas with the horse, it just is whatever is going on in their body, and often with even behavior and crankiness, they're just a bit sore, and then as soon as you take that back soreness out, they're in a much better mood. And
do you take the back soreness out by manipulation of the muscle in the spine? So I've worked with Belinda as a patient, and it's been really a profound experience for me, because as an athlete who's now in her 50s, I have all kinds of compensations and issues in my body that come and go. And so I know in my body what it's like to be a patient and to have those manipulations occur. Of course, I've only had maybe 4 sessions, so I haven't gotten into the depths, but I'm really curious about, is there an overall procedure? Do you typically see your patients, over the course of long periods of time, or is it time limited?
Sometimes, yes. It's different for everybody, and where they're at, and what's going on in the age of the horse, and the workload of the horse. But I do have horses that I have seen since I've been here, so over a 3-4 year period, and it is incredible to see them change and to see their bodies change. And it's not just me, it's I'm part of the team with the trainer, with the stretching and the work that the horse owner will do on their own, and it works in combination with the farrier and the vet, and for the well-being of the horse. That yes, I have seen wonderful changes in how a horse moves and how they maintain their, for example, one horse I'm thinking of who's one of my oldest horse clients, not in age but since I've moved here, and he was a thoroughbred and was so heavy on the forehand and just so muscle bound the shoulders, and would just basically drag himself along, even though he's quite a big muscular horse, and working on that, freeing up his back end to allow that movement where the horse's engine comes from, and to allow that curling under and that self-collection, and then just stripping back that tension in the shoulders so that the movement can move through. And he just looks so different now when he moves.
Do you find with your horse clients that sometimes they may not want treatment, or how do you open the relationship with your horse clients?
That the horse might not want treatment?
Right. I mean, you know, sometimes like an owner may say, my horse seems stiff and I'd like you to work on my horse, but then you have to establish some kind of working relationship with the horse, and you know, are they resistant, or are they just completely open?
Well, I think
what's it like?
The interesting thing is that people who look for my services really care for their horses, which isn't to say that if you don't use my services you don't care, but these people obviously really are doing all that they can for their horses. So they are, I find, very open and interested. They ask a lot of questions. I find that quite wonderful, actually.
So the horse is usually, okay, so they have an owner who's really open and interested, but is the horse open and interested?
Want the
I'm
treatment?
just curious, like I'm picturing you in my mind's eye, you know, arriving at the barn, and it's a new horse client, and you get to the stall or the cross ties or wherever you treat, and you
the first time the horse, if it's the first time a horse has ever had treatment, they are a lot more nervous. Like I said, the mind is out of it, so they're often nervous because one, it's some kind of health professional, and usually they're used to dealing with the vet, and that often involves discomfort and a needle or something, so they can be very unsure and very nervous. And then if it's their first time, they've got muscle tightness, they've got pain, they've got soreness often, which is why I've been called in. So they're sore, and then they don't understand, like, why is it sore? Why is she touching my sore? So there's movement and there's nervousness, and depending on the breed and the age of the horse, depending on the owner, because as you know, horses will pick up on the owner's anxiety or level of relaxation. But then what I find is after that first treatment, they're usually very relaxed and very receptive, because they remember when they see me, that they feel good. I've had horses start licking and chewing as soon as they see me, or just backing their back into me.
Wow, they know. They say more and more.
They've felt so good.
So what are some of the reasons why a horse or owner might want treatment for themselves, or a horse might want treatment for their horse?
So the horse will, things like lead changes, you know, they're not getting the correct lead change, they're not as bendy to one side, they're refusing jumps, they're...
So problems,
yeah.
Problems
with movement.
Okay.
It's all about
which can
movement.
be translating to problems with training.
Yes. So that's why in combination, when I work with trainers and their horses, it's such a wonderful team effort, because they're getting fitter and they're getting these habits corrected in training, and then they're getting their body open and flexible and supple and able to do what they're asked.
And what about for the rider? What would cause a rider to want to have sessions with you?
Oh, well, osteopathy can help with any structural problem. So riders, for a start, most riders have had some kind of trauma. Equestrian
so you have to fall.
Is a dangerous sport, so trauma creates dysfunction and imbalance in the body. So, you know, sciatic pain, that's common, headaches, hip pain, shoulder pain, any kind of stiffness or joint or muscle injury.
And so it's really about structural challenge that might equal pain. For the horse, it's more obvious by their behaviors,
because they can't tell us, so we look at the signs
but it isn't necessarily like that the horse is lame or.
Oh, I do work with in conjunction with vets with lameness issues, especially if it's something that's clearly muscular, skeletal, or ligament related. But even if not, say if it's a foot thing or something that's non-systemic, meaning not a disease process, it helps to keep them in balance, because when a horse is lame, they're imbalanced, you know, they're favoring that one foot or one leg, and things get thrown off. So I do work with lameness issues as part of the team.
So it sounds like it's also very psychological for the horse, because when the horse's experience of physical limitation changes, then they're able to feel happier and more interested in engaging with the human-horse collaboration and the training process.
Yes, and they do work from habit too a lot of times. So it feels better, like that muscle feels better, that part of their spine's more open. But when they move out, it's interesting to see them, they'll just start moving out of habit, but then as you lunge them or keep working them, they realize that it frees up, because they have a muscle memory. Their muscles are huge and they retain that neuromuscular memory. So often you do need consecutive treatments to retrain and reset that pattern in the nervous system.
So do you think that the muscle memory in the horse is a strong part of how the horse thinks?
Yes, because their muscles, if you look at their muscle tissue and their muscle mass, it's bigger than their brain.
Wow, yes. They have a really small brain relatively. 0.01% of their body weight is their brain, as opposed to a human, which is something like 0.2. So really, or more, I'm not sure, but I just studied and read that this morning, and I thought, wow, that is so profound. And yet the horse brain is, it's mostly instinctive. So the horse's emotionality changes, and then their physicality changes from the work that you do. And then I'm interested in how that affects the rider, because sometimes if the rider is having a physical problem that's coming from their horse's imbalance, do you notice that their problem shifts just kind of naturally, or do they too need the sessions to change their muscle memory?
That's a good question. Well, a rider can do a lot for themselves. Right? They can go to yoga, they can do isolated stretches or strengthening.
Right. And so what do you recommend for self-care of the athlete equestrian's body?
I think with relation to what I do, of course, I'm going to say treatment's great, but even treatment like once every 6 months as a minimum, just to tune in and get a checkup and get things aligned, and as a minimum. But if you have other problems or more chronic problems, then treatment does really help. Walking, anything that keeps the body moving, keeps the body strong, swimming, walking, basically you do what you enjoy. And people love riding horses, which is a great exercise. It is good to counteract some of those forces. Right.
I find with the athletes, a lot of the athletes I work with who are equestrians, they don't cross-train the way I think would be beneficial to their to supporting their structure, as well as to having the cardio and the strength and flexibility. It's a marriage. And so I really I like that you were talking about yoga and different kinds of cross-training, because it seems essential for any athlete.
I really like Pilates. I do Pilates, and I find when I'm doing Pilates, I'm noticing that, these are really my horse riding muscles that I'm strengthening and engaging, and then when I'm on the horse and I remember to switch those on, I like Pilates. So
you become really aware of the muscles and muscle groups and how they can help you through Pilates. I definitely think that's great, and that's something on my agenda to experience more of.
And yoga's great too, and you can actually do yoga stretches while sitting in the saddle on horseback, and that's something that can help the horse, you know, that they're just feeling this quiet movement and stretching in a different way than how they're asked to move, and they don't have to do anything while you.
But they feel what you're doing, and that affects that. And I learned something recently in studying the horse's brain. Since I'm a kind of a neuro nerd, I like to learn about brains, and so I was studying the horse's brain, and the corpus callosum, which is the material that blends the right and left brain and helps them to communicate in a horse, is way less developed than it is in a human. So that's why a horse has to learn something on that they've learned on their right side all over again on their left side. Whereas, you know, if I learn to use my fork with my right hand, I can, without thinking very much about it, use my fork with my left hand. And whereas a horse, if you teach them how to canter on their right lead, that doesn't mean they know the cues for the left lead. You have to go back and then teach them those cues and what that means and how that feels.
Yeah, that's why I always tell, that's very interesting, and that's why I always tell people to stretch both sides, even if it's their right shoulder that's tight and imbalanced. You know, the body will sort it out, but they need to do the stretching and the neck stretching on both sides of the horse.
That makes really good sense. And do you teach your riders sort of a pre-ride routine or practice for supporting themselves and their horses? Like you're just talking about stretching.
I don't. I think there's that line you don't want to cross with trainers or being perceived to be a trainer. So if somebody asks me for stretching or whatnot, I will. But do
you think that, I mean, it sounds like, and it makes sense to me as a yogi and an athlete in general, a pre-ride stretch. I notice, you know, riders, they're sitting or whatever, and then suddenly they're in their boots and breeches and getting on the horse, and I always think, well, in every other sport we do we warm up
and warm up the horse too.
Right. I mean, they do go to the warm-up ring, but I think that there's something that the rider needs to do to loosen the joints and to become get all their muscle parts engaged. And I suggest this all the time.
Yeah, it's a great idea. And there certainly is very simple things that would take 1 minute, you know, if you do 30 seconds of each stretch, that you could do to stretch the calves and the quads and the hamstrings and open up the legs before getting on the horse. Definitely.
Sometimes I see people pick up the horse's front leg and pull it forward to kind of loosen up that skin underneath the girth. Is that, like, what would you recommend as 1 or 2 things to do to help?
That's a good one. And it's not just the skin, you're stretching the back of their shoulder and their trapezius and down through their rotator cuff. Yes, that's a nice one. I recommend often the carrot stretch. There's a whole series of stretches to lengthen both the bottom, top and front and back of the horse's neck. I mean, it's such an important piece. It's involved in balance and turning, and that
makes sense. In a subsequent video, maybe we can show examples of that. That would be lovely for people to understand exactly how to do it and why, rather than, oh, this is cute. But it is cute. And what's really neat about anything that's cute and that elicits that sort of sensation in the human for the horse is that the connection.
And also they do start to learn what their horse's body is doing. They start to get a feel for, oh, right, yes, he's stretching more this way, it's a lot smoother. Oh, he's being a little bit, you know, stiff or a little bit unhappy to go that way, and they start to tune in and to get a feel for the horse's body and what
that makes really good sense before you're mounted. And then I'm imagining from this perspective that you work, but then the rider can also do some stretches to be aware, like, oh, if my horse is really stiff on the right side, I'm going to really, you know, loosen up my right side so that I can at least offer some extra mobility in that department. So can you tell us a story about an interesting case with horse and rider, or horse or rider, that you've had of recent?
I did have one gentleman, and I started working on his horse, and the horse was very well trained in a lot of liberty work and bareback. And
what's liberty work?
Liberty, I don't know. I can't give you the
is it
explanation.
Like it's a kind of riding, like hunter jumper, or?
Liberty is I really don't know to tell you how someone would define it. It's doing work on the ground,
okay, with
cues, natural horsemanship.
Okay, I understand. I've never heard the term, so I thought.
Oh right, maybe it's an Australian term.
It could be.
And then,
sorry,
on the horse and just reinless, but just using the body and giving cues and using your body and breath. So I'd work on the horse's back and it would free out and be great, and then it would just kept coming back, the same pattern. And the gentleman I told him about the osteopathy and what I do, and he finally came in to see me, and what do you know, he had the same right-sided lower back and hip problem. And when we started working on his right-sided lower back and hip, the horse's treatments held and were better, and he stopped getting as stiff through there. So that was interesting.
It just makes perfect sense to have the horse and the rider being worked on by the same practitioner. I mean, there's just so much mirroring. I mean, really, you think of the centaur and the horse human in mythology going back to at least Greek times, if not before, and how that blend, I mean, that's how civilizations warred, and that relationship between horses and humans is so strong when you're on the horse. So to treat them
it never
together.
ceases to amaze me. It never ceases to amaze me when I treat the rider and find the same pattern.
I'm sure
horse.
It doesn't.
And the people who see me regularly themselves and their horse are starting to notice that pattern, and
I imagine,
and work with it a little bit.
And in the winner's circle, most of my members, if not all of my members, are hunter jumper riders, and so their horses are focused and their athletic endeavors focused on jumping. And can you talk a little bit about jumping and how that affects the horse and how that affects the rider, and do you treat them differently?
Wouldn't say I treat them differently. I treat every horse as an individual. I know so many techniques, and I don't have the same. I have a different approach according to the individual. However, I find a similar pattern amongst hunter jumper horses because of the nature of the work that I do, that they do, and the strains that are put.
And are those patterns like a hind end issue?
Yeah, lumbosacral area, very, very commonly in almost all of the horses. I will work at freeing up that hind end, and often the mid back, because of that pivot point of when they jump, that balance point. Those are the main two things, and then depending on the horse and the horse's pattern, because horses are sided as well, like they can be right-handed or left-handed, as are we. So there are areas in their lower neck, either right or left, and then there's often pole issues that go on, because whatever happens in the lumbosacral area pulls all the way up into
that makes sense.
The pole.
And do the riders reflect? You have a lot of riders with lumbar sacral issues as well?
Well, hips, I know with equestrians, a lot of hips, where the way that the nature of using your leg and sitting in the saddle, but it's more varied. It is definitely more varied with people and what
they have a life experience beyond.
Exactly,
yes. And is it different between genders? Because women have wider hips. I'm just sort of curious.
Yes, women, well, it's interesting. Men do tend to have, just in the general population, men tend to have more lower back problems, and women more neck and shoulders. We tend to carry our stress more up here.
Up where our voice is seated.
And it's finer necks.
Yes, interesting. So if somebody were to come to you, a human were to come to you for treatment, tell a little bit about how you start that process and what they might experience.
Okay, so I'd take a history, a medical history and a health history, and that gives me an idea of all the history and the story of what's happened to their bodies, and then I do a physical assessment and physical examination and look at the movement and any special orthopedic type tests that might help with determining what's going on or what the cause of their problem is. And then based on all of that, I would do a treatment which involves gentle manipulative techniques of the body.
Wow. And then from there you would suggest a series of sessions, or say, you know,
the management. Yes, I'd suggest some exercises they might do, and
hopefully
and
they'll do them.
How often they need to come back.
And do people typically come to you once injured or once, you know, debilitated?
It's different.
Yeah,
for
it depends.
everybody.
Okay.
Yes.
And so I know, like, when I've worked with you, you've also suggested supplements. You've like that calcium that you gave me, which I need more of. It's fabulous. It's changed everything. I mean, so many simple kind of kitchen table wisdom.
Yes, and also I have a training as a herbalist and naturopath, so I have an understanding of where the imbalance is and what might be causing it, and based on your symptoms, and I also can look at, people do bring in their blood work, we can determine where and how they can come into balance. But it is general knowledge to a degree that magnesium helps the muscles, and I can often tell just in horses and in people if they are magnesium deficient just from the quality of their muscle tissue and the elasticity. And speaking of magnesium, horses are very commonly depleted because it's a muscle mineral, and every time that they contract those muscles, it uses magnesium, and it's a calming mineral as well.
Yes.
So it can really benefit them if they're really tight and highly strung.
So it's a good place to start with the dietary influence or influx of magnesium. I know for me, magnesium, I take magnesium powder every night, and it relaxes my brain and my muscles. And then I have a small yoga practice that's restorative, and that changes everything when I do that and don't do that. So let's see. So with the horses, do you ever prescribe herbs to horses?
Sometimes, yeah. I've actually started experimenting with that a little bit more in the tincture form, because that's how I like to make up unique herbal remedies, is as tinctures, and then they're faster acting, faster absorbing, and you can use different herbs to really target what's going on with a specific individual. So I've discovered that if I put sugar syrup in the tincture, then the horse will eat it with their supplements.
Wow, that's beautiful. Do you need a lot since they're so large?
No. Slightly larger dose than with a person, but they have such absorbent, sensitive digestive tract, and you don't need to overdose. And
do you find that digestion is a big issue since the horse has such a large tract with only one exit?
Yes, it is. And you know, I've read the work from Dr. Carrie Ridgway, who says that about 80% of horses have ulcers.
Wow.
And a lot of times you can tell with certain muscle points and certain points along the ribs that could be pointing towards ulcers and behavior. And so it's, you know, in that environment at a show barn where they're in a smaller stall and they have limited turnout, they don't get that movement through their digestive tract. So
that makes sense.
I think it's an unidentified problem.
I think it's a huge problem. I know a lot of horses go on GastroGuard for showing, which I don't really even know what's in that, but I know that it's to address
ulcers,
but it seems like a preventative medicine or a preventative approach of addressing the horse's digestive tract is really essential.
And also with the osteopathy, it really helps too, because their ribs are a big part of, so horses that you know, we put the girth on and we cinch them, and that goes, and we use our legs right on their ribs, and the ribs, the diaphragm moves the ribs, and then the diaphragm moves the internal organs and the intestinal organs. So when they get really stuck in the ribs, and that's a thing I see commonly, is the ribs out and the ribs right back behind the leg, then that stops that complete movement of the diaphragm, and that can then lead to some. So
then the horses aren't breathing fully in and out, and they're getting stale air and not being able to oxygenate,
and not getting the movement through the intestinal tract from the diaphragm. It's all connected. It's just everything is constantly interrelating back into into the whole.
So again, is there an herb or a supplement or something that you see is kind of missing in a lot of show horses' diets?
Well, I do think magnesium is the start, and just from the way their muscles are. And you know if you're getting, the beauty about magnesium is you know if you're getting too much or if the dose is too high, because the stools will become running. So it's very safe, it's very necessary. It's not necessarily tying straight into digestion, but as a start.
What about with humans? Do you notice digestion issues are related to?
Very commonly. And with my naturopathic background, that's part of the naturopathic approach, is often to heal the digestion, the guts first, and our digestive system is everything from the whole tube from the mouth to the other end, which makes up most of our internal organs. So if that's functioning well, really we're in good health, because that's where we absorb our nutrients from, that's where you eliminate waste from. It's very common with our modern diet and processed foods. It's a big problem.
Well, and there's an emotional content, because as a psychologist, I see that we digest we digest everything that that we come into contact with, and maybe more, through the course of every day. And yet if we don't have some sort of clear practice for elimination, not just of the physical form, but of the energetic, emotional form, there are a lot of blockages
that manifest. And then they manifest in the physical.
Exactly. Which is why I've been trained in Ayurvedic medicine, and so I work a lot with digestion. But I'm really appreciating that there's an anatomical, muscular, emotional and intake relationship. It's bigger than we know. I think it's really important. I hope to have future conversations as specific issues come up in my practice, or from Winner's Circle members, or anybody who's watching this who's interested in, including Belinda's clients, who are interested in exploring the vicissitudes of the anatomy, the physiology, the energy, the digestion, and the horse-human relationship. Because I feel like, what I really appreciate is how all-encompassing your work is. And one last question before we close is, in your training, it was specifically for the equine and the human, and then the equine.
Dogs.
But that's what I wanted to ask you. Do you work on dogs?
I do. I don't really advertise it, but I do get asked often to work on dogs. And dogs are amazing to work on because they're so small. I mean, talking about anatomy, they're so small. They respond so quicker than people and horses, and they get better in a fewer treatments. That's what I found. And I think as dogs can rest a lot. I really do.
They're not under such stress with the training and everything. Wow. So that's wonderful.
And you were asking about whether the treatment helps the horse person connection, and it does, because often, like I was mentioning, that you asked the stretching and showing them, or I'll show where they can rub the liniment, and it's offering that connection. It's offering that, like, giving back to the horse, and you're touching the horse, and you're not asking anything from the horse, which often we do ask a lot. So it is nurturing a deeper connection with them.
I so appreciate that lens through which the connection is deepened on every level, because then when you go out there and you work to achieve a particular goal, the connection has such a strong foundation. So wow, thank you so much, Belinda, for being here and sharing your gifts. And this is Dr. Carrie, and thanks for being with us.